Good morning, everyone. Thank you for joining us here today. Thank you to Dr. Rusin and Dr. Reimer for also being present for today's discussion. So today we're here to discuss the COVID-19 situation in Manitoba, the importance of getting vaccinated, and most importantly, keeping your immunity up by getting the third dose when you're eligible. Rising case counts and COVID-19 transmission in the province are placing increasing pressures on our health system. Case counts and hospitalizations are rising, and Manitobans are encouraged to be proactive in protecting our healthcare system and to also help us to ensure we have hospital beds available to continue to provide care for patients in need. Healthcare workers, as you know, across Manitoba have been growing very weary of the pressures being placed on them and our system by COVID-19. We're grateful for their continued efforts and their commitment to the health and well-being of Manitobans. But most recently, we've been told about a new threat, Omicron variant. It's here in Manitoba. However, we are not helpless in the fight. We need everyone to work together and follow the public health orders, focus on the fundamentals and get vaccinated, especially as we head into the holidays where families and friends like to come together in large groups. It will be very important that you follow those fundamentals of washing your hands, staying home if you're not feeling well, and ensuring that if you do have symptoms that you are tested. I'll now pass it over to Dr. Rusin to provide an update from Public Health. Dr. Rusin.
Thank you, Minister. Good morning, everyone. Brent Rusin, Chief Provincial Public Health Officer. So I want to start today to provide Manitobans with some of the information we have regarding the Omicron variant. We have detected very few cases in Manitoba at this point, so we need to rely on data from other sources right now to show the potential impact in Manitoba of Omicron. If we go to the first slide. On here, so we've heard of this new variant of concern, first detected in South Africa. Since then, it's been reported in most jurisdictions in Canada, many countries around the world. We know definitely it is much more transmissible than the Delta variant. We are still learning about the severity, still learning about the impacts of vaccine and prior infection. On the next slide, we know that we have seen that clear growth advantage over Delta, which is why we are most concerned about this. There are questions regarding how severe it is, but just to be clear, with the amount of increase in transmissibility, it would have to be very, very significantly less severe for this not to be a threat to us. And so it's very unlikely that we can rely on that. So we need to be very prepared for a exponential growth of Omicron throughout Canada, including Manitoba. On the next slide, we can see some of that, the evidence of that increased transmissibility in other jurisdictions. In the UK, we can see that doubling time of 2.5 days. And so this is quite significant compared to Delta, which was 34 days. And we know how much an advantage Delta had over the prior variants and wild type virus. So in Ontario, from their science table, we've seen that doubling time of 3 days, and we've heard of their exponential growth that's occurring there. The effective reproduction number, again, that number, the average amount of individuals that a single infectious person spreads to, you can see it's 4 times that of Delta. And we know the harms that Delta have caused. So this is bringing us to be quite concerned about the potential impact of Omicron here in Manitoba. On the next slide, so this again is from the Ontario Science Table dashboard, and this is not modeling. This is an actual plot of the cases. And so you can see that exponential growth of Omicron in that jurisdiction. We still see the significant amount of Delta right now at this point, but that exponential growth cannot be missed on those charts. Again, looking at other jurisdictions, some modeling provided on the next slide here from BC, much the same. If we assume essentially an underestimate of the growth rate that we've been seeing in UK, we can see that rapid exponential growth of Omicron over just weeks. If we look at some Manitoba modeling, again, we need to be cautious with this. We don't have many cases here, so we don't have data that we can rely on. What we're doing here is plotting out what would Manitoba look like if we followed the same pattern that we've seen in other jurisdictions, and there's no real reason to think we wouldn't, but you can see how rapidly Omicron would take over as our dominant strain, and that rapid case rise. And like we know in the past, this is going to result in increased hospitalizations and ICU. Again, we don't have details yet on just how severe Omicron is, but with transmission like this, we cannot rely on it not being severe enough to cause us harm. An update on Manitoba's numbers here. So we've had 6 confirmed cases, 2 of them travel-related, and 4 close contacts of a known case at this point. 2 of those cases were fully immunized and asymptomatic, 4 unimmunized, and 1 was symptomatic with 3 asymptomatic, but we're not aware of any severe disease, but these are very low numbers. We can't base our modeling, can't base severity on these numbers, but we know from other jurisdictions, once we see this spreading in the community, we are weeks away from it being our dominant strain. And so it's introduced here in Manitoba. We can expect to look like other jurisdictions in the very near future. So we need to act now to decrease the impact of this very concerning variant in Manitoba. So we can see from these slides and from other jurisdictions, very clearly more transmissible. And we know that it's here already. We know it's in Canada. It's going to be in Manitoba, spreading in the community very shortly. And so we've been here before. We know what to do with this virus. We have a new tool, vaccination, compared to many of our other waves. And we know that our best protection against this variant or any of the other variants that are circulating is to be vaccinated. We know now that 6 months from that second dose, we see some of that waning. We see in the older population, again, being at increased risk. So we're making that plea to Manitobans to do whatever we can to get as many eligible people vaccinated. If that means your first or second dose, we need that. And if it means you're eligible now for your 3rd dose, we need as many Manitobans to get that vaccine in the next 2 weeks before what we know is going to be a large amount of gathering during our holiday season, before we have widespread community transmission of Omicron, which we also know is on its way here. So please get that booster dose as soon as you're eligible. It's our best protection against Omicron and any other variant. Again, with public health, we need to follow the restrictions that are in place. We also need to take actions based on our individual levels of risk. We need to decrease our personal contacts. So certainly following those public health orders, decreasing the amount of contacts we have. We need to rethink our plans over the holidays of large gatherings. Especially if you are at increased risk of severe outcomes of COVID. If you are over 60 years of age, if you have underlying medical conditions, you need to be very, very careful about your plans to gather over the holidays. They should not be large gatherings. We want everyone vaccinated. If you're due for your 2nd dose or 3rd dose, you need to obtain that. But we all need to reconsider our holiday plans because Omicron is on its way here. So again, that best line of defense is vaccinated, whether that's your 1st, 2nd, or 3rd dose. do so at your earliest possibility. And again, that protects you and the people around you. Staying home when ill, washing your hands, these are all continue to be important. And we need to, again, rethink about things like physical distancing, rethink about decreasing those gatherings, decreasing our personal contacts outside of our household, especially if you are at high risk. So again, we have a number of cases reported every day in vaccinated people, but to be clear, the vaccine is very effective, it's very safe. So if you look at the risk of becoming a case, it's 5 times that, or 4.3 times that of in the unvaccinated than compared to the vaccinated. 11 times more likely to end up in hospital if you're unvaccinated, and 18 times more likely to end up in ICU. So vaccine is very safe, it's very effective, and it's continuing to be our best protection against this or any other variant. So please, we are making that plea to Manitobans to get vaccinated as soon as you're eligible for whatever dose you are eligible for. So we'll continue to work together. We've done this before. We all know about those fundamentals. We now have vaccine at our hand, but we do have this concerning variant coming to Manitoba and soon to be spreading in our communities. So we need to take action now to ensure we're safe throughout the holidays and into that new year. So, so thank you, and I'm going to pass it back to the Minister.
Thank you, Dr. Roussin. And as we know, through this 4th wave, it has been very difficult for individuals within our province, but I can't emphasize enough the importance of following public health orders and focusing on the fundamentals that Dr. Roussin mentioned. We know vaccination works, and once again, I encourage all Manitobans, please do your part and get immunized against COVID-19. This includes getting your 3rd dose, which we all refer to as our boosters. Recently, 3rd dose eligibility was expanded to better protect Manitobans through the 4th wave, so there's no reason to say no. I'll now pass it over to Dr. Reimer to provide an update from the Vaccination Implementation Task Force. Dr. Reimer.
Thank you, Minister, and thank you, Dr. Roussin, for that presentation. I'm Dr. Joss Reimer, Medical Lead of the Vaccine Implementation Task Force. I'd like to speak today about the importance of immunization in the face of the arrival of the Omicron variant beginning to spread in Manitoba. The modeling that was shared by Dr. Roussin today is concerning. I hope that sharing this information will result in immediate action on the part of Manitobans who need to get their 1st, 2nd, or 3rd doses. The holidays are fast approaching, and many gatherings with loved ones and friends are planned. We're all living in a time of rising COVID-19 case counts and waning immunity in our communities and around our family dinner tables. More than ever, the time to get your next dose, if you are eligible, is now. Our healthcare system is already significantly strained. Responding to the increase in cases which are forecasted will make things even more difficult within our healthcare facilities. Please do whatever is within your power to protect the healthcare system, protect the people who are being served by it, and all of those who are working tirelessly within its walls. On Monday, we asked Manitobans to take an urgent step to receive their doses in the days ahead. And now we're asking again. We're strongly urging all Manitobans 60 years of age and older who received their 2nd dose on or before July 10th to go get a 3rd dose immediately. Also, anyone who is 18 years or older and living in a First Nations community who received their 2nd dose before July 10th or earlier should get a booster as soon as possible. Children aged 5 to 11 can receive the vaccine. And many youth aged 12 to 17 are eligible or about to become eligible for their 2nd dose. Each one of us matters when it comes to protecting all of us each dose counts. Parents can book today for their eligible children. This really needs to be the most important item on your holiday season to-do list. For people who are immunocompromised, if you got your third dose because of your immunocompromise, you should still receive another booster like everybody else 6 months after your last dose. This is to make sure that your immune system is protecting you as well as it can, as people with immunocompromise may also experience waning immunity. I want to take things a step further in light of what we now know about Omicron's spread in other jurisdictions and say that it is critical that if you're eligible, you get your booster dose before you begin gathering with loved ones. For children, we do still recommend 8 weeks should pass between the first and second dose if they're between the ages of 5 to 11, or a minimum of 21 days for children living in First Nations communities. But now that Omicron is here in Manitoba, people are worrying about how well they're protected. One important thing that we are seeing in the early data is that previous infection may not be providing as much protection against Omicron as it did against other variants. Omicron also has some features that scientists are concerned may make the vaccines less effective. But what we know to be true is that the vaccines still help to protect you, especially against severe outcomes. I hear from many people who wonder how much protection they get from the vaccine. Early evidence suggests that any decrease in protection against Omicron can likely be overcome by getting a booster. So that's good news. When you get a booster dose, your body gets flooded with antibodies, bringing your antibody level to an even higher level than what you would have had after your second dose. So while a smaller percentage of the antibodies will effectively recognize Omicron, when you have such a high number of them, that still means that there will be a large enough number of antibodies that will be able to work and protect you against this variant. Also, antibodies are not the only part of the immune response that works against Omicron. T cells, for example, are very good at preventing severe outcomes. And so far, for vaccinated people, it looks like the T cells are still good at recognizing Omicron. But that doesn't decrease the need for a booster. The booster will not only increase your antibodies, but it also increases the other cells in your immune response, like T cells, making them even more effective. Many people are wondering, what is the fastest and easiest way to get the vaccine in Manitoba? So I would say first, your best bet is to go on ProtectMB and look at the vaccine finder map online to see where doses may be available. We have plenty of doses of vaccine in Manitoba. This tool will show you the pharmacy or clinic locations where doses are available, and there are hundreds of locations out there. You can also call a pharmacy ahead of time to check. Many of them will take walk-ins, but it's good to call ahead of time so that you're not disappointed or end up turned away. We thank all of our pharmacy partners and our physician partners for stepping up to serve Manitobans with the vaccine over the holidays. And to the staff and the management of those pharmacies and clinics, we appreciate everything that you can do to expand hours so that as many Manitobans can be immunized as possible throughout December. I should tell you that we have heard that some folks have recently visited a regional vaccine clinic and didn't have an appointment, so were not able to be immunized. Not all of our clinics, also known as super sites, have walk-ins available. The convention center, for example, in downtown Winnipeg, sets up with the doses that are needed for that day for the appointments already scheduled. So this is another good reason to use the vaccine finder tool on protectmb.ca to locate where you can go and get that vaccine. Your doctor or pharmacist will likely be the fastest route to a pre-holiday season dose. You can call the province's call center. You can book through the online booking tool as well. But don't wait if you aren't able to get an appointment through the provincial system right away. It's important to get that immunity now before you start to gather with loved ones, and so it may be faster to see your doctor or go to your local pharmacy. These doses are extremely important. I would like to reiterate the information for those who may not have heard it yet. First, we know that COVID vaccines are highly effective, but no vaccine offers you 100% protection. And over time, the effectiveness of your vaccine may become weaker. This happens at different rates for different people, depending on the strength of their initial immune response, their health and health conditions, their age, and many other factors. So while being fully immunized provides excellent protection, it doesn't mean that every single person who is fully immunized shares the same level of protection. Over time, our immune response will decline. This is normal, and this happens with our immune response to any infection or vaccine. And it's why we get booster shots for many other vaccines, like influenza or tetanus. With COVID, though, decreasing immunity, especially in the setting of Omicron, can be serious for people at greater risk of illness and people who are more likely to be exposed to COVID, and especially those people who might already have something else that's impacting their immune response. Waning immunity places you in a vulnerable position where you could also catch the virus and pass it on to others. And that's why waiting for your second or third dose is not a good idea. The emerging medical evidence suggests that COVID-19 vaccines will likely offer some protection against Omicron. Because even though Omicron is a new variant, it's still COVID. But the best way to get your body ready, if it should happen to come into contact with COVID, whether that's Omicron or any other variant, is to get your booster dose. There are literally hundreds of locations in Manitoba where you can receive your COVID-19 vaccination, and there is no shortage of vaccine supply. Please don't wait another day. If you're unsure of the date of your last dose, this information is available through the website where you can see your doses. And so we encourage you to check that instead of guessing when it may be time for your booster. So please call our call center, visit protectmb.ca, and check out the online vaccine finder map to find a clinic or pharmacy near you. And I will now turn things back to Minister Gordon.
Thank you, Dr. Reimer, and thank you to Manitobans who've been vaccinated and are doing their part to protect their own health and those around them. We can get through this together, and I thank you again to everyone who has joined us today, whether it's live or here at the Convention Center, for this discussion. Thank you. Stay safe and be well.
Yeah, and so maybe I'll get Dr. Reimer to discuss that one. But yeah, there is adequate supply. It's distributed about around the province. So need to go online to that vaccine finder, find a place that has it, because there's a lot of vaccine out there. It's